All right, future RNs, let's talk. If you're getting ready for the NCLEX, you know there's one section that can feel like a total puzzle: management of care. Well, guess what? Today, we're cracking that code. We're going to give you the key to unlock it. First up, let's get a handle on just how big this section really is. 18%. Just let that sink in. Nearly 1/5 of your entire NCLEX-RN exam is dedicated to this one single category. That's not just a small slice, that's a huge piece of the pie. So you can see, nailing this section isn't just a nice to have, it's absolutely critical if you want to pass. So let's build our game plan. So here's our roadmap for today. We'll start by looking at the challenge itself, then we'll dive deep into delegation and assignment. After that, we'll cover your legal and ethical playbook, talk about essential team communication, and then, we'll test your knowledge before wrapping up with the final takeaway. Yeah, I know, seeing that 18% can be a little intimidating, but I want you to start thinking about this section differently. It's not just a hurdle, it's really a test of your leadership and your critical thinking skills. The NCLEX wants to know, can you think like a nurse leader? And this explainer, it's all about turning that anxiety into confidence, breaking it all down into pieces you can actually manage. So where do we even start? Well, it all boils down to two core concepts you absolutely have to master: assignment and delegation. Now, I know they sound pretty similar, but the NCLEX just loves to test you on the small but crucial differences between them. Getting this right is your first big step to crushing this section. Let's get this straight, because it's super important. Assignment is basically just divvying up the workload. You're giving the right tasks to the right people based on what their job is and what they're legally allowed to do. But delegation, that's a different beast. When you delegate, you're handing over the responsibility for doing the task. But, and this is the part you need to highlight, underline, and circle, you, the RN, keep the accountability for how it turns out. You're still the one in charge. Okay, so how do you delegate safely? Easy. You use your built-in safety checklist, the 5 rights of delegation. First, is it the right task for that person's scope? Second, is it the right circumstance? Meaning, is the patient stable and is the outcome what you'd expect? Third, is it the right person for the job? Someone with the right training? Fourth, did you give clear, specific, right direction? And finally, do you have a plan for right supervision and evaluation? If you miss even one of these, you're putting your patient at risk. Okay, so we know how to delegate. But what about the principles that guide literally every decision we make as nurses? That's where your legal and ethical playbook comes in. Think of these as the essential guardrails on the highway of nursing practice that keep you and your patients safe. These aren't just ideas to memorize, they're the rules of the road. It all starts with autonomy. That's the patient's fundamental right to be in the driver's seat of their own care, to make their own choices. Then we balance that with beneficence. This is our duty to always do good, to actively make sure we're acting in our patient's best interest. And right alongside that is non-maleficence. You know this one. First, do no harm. It's our promise to protect our patients, especially those who can't protect themselves. And what holds all of this together? Veracity, truthfulness. Because without honesty, there's no trust. And trust is absolutely everything in the nurse-patient relationship. So we've got our ethics down. But great nursing management isn't just about what's in your head. It's about how well you can get it out to your team. In a crazy, fast-paced hospital setting, clear, structured communication isn't just polite. It's a critical safety tool. And the king of all communication tools, it's gotta be SBAR. Let's just run through this. Situation: Dr. Preston, Nurse Lee here, calling about Mr. Lawson in room 204. He's having trouble breathing. Bam, right to the point. Background: he's a 54-year-old with a history of chronic lung disease. That's the need-to-know context. Assessment: I'm not hearing any breath sounds on his right side. I think he has a pneumothorax. This is your clinical judgment. And finally, recommendation: I really need you to see him right away. I think he's going to need a chest tube. See? It's a clear, actionable request. Mastering SBAR means nothing critical gets lost in translation. Okay, enough theory. You know the NCLEX is all about putting this stuff into action. So, let's see what you've got. Ready to try a couple of NCLEX-style questions? Let's do it. All right, first one up, take a look. You're the RN calling the shots. Which of these tasks can you safely hand off to a UAP? Really think about their scope of practice. What's a routine task and what requires that core nursing judgment? Go ahead and pause here if you need a sec. Did you get it? The answer is C, assisting a patient to the bathroom.
Why? Because it's a routine task that doesn't require clinical assessment. Administering meds or doing a sterile dressing change, that's more for an LPN. And conducting an assessment, that is 100% an RN's job. That's the kind of critical thinking you need.
Okay, one more. This time, we're focusing on our 5 rights. Which of these statements really shows that the RN understands the right supervision and evaluation part of delegation? Remember what we said about accountability. Where does it stop?
Yep, it's B. And this one is huge because it gets right to the heart of what accountability means. Delegation is not a fire and forget mission. You can't just assume it's done right. You, the RN, have to close that loop by checking the work and evaluating the outcome. The other options? That's just hoping for the best, and hope is not a nursing strategy.
So, what's the big takeaway from all this? How do you conquer the management of care section? It's not about memorizing a million tiny facts. It's about truly understanding the core principles: delegation, assignment, ethics, and then applying them with solid communication and even better judgment. That, right there, is your key to confidence.
Remember that key we talked about at the beginning? You're holding it. The NCLEX isn't just asking what you know, it's asking how you think. So from now on, with every practice question, ask yourself, am I just picking an answer, or am I making a real leadership decision that protects my patient? Think like a leader, and you won't just pass this test. You are going to be an incredible nurse. You've totally got this.